This is Dr. Drew Hall again with Upper Cervical Health Care in Los Angeles and Carson. We're going to review a cone beam computerized tomography scan, cbct. This is a very good example of the Blair upper cervical technique at what we look at as far as how the mid and lower cervical articulations either match up or have been misaligned. So if you can see my cursor here, this is the ring of the atlas. And then as we go down, here's the C2 on C3 articulation. I'll blow this up a little bit for you. In a really clear misalignment, you can see here, this is fourth cervical here. Here's the articular margin moving up, and here's the anterior margin where it ends. And the one below, you can see the fourth cervical joint. It ends all the way up here. So that joint right there should be even with this one. Then we move to the one above. We see a massive posterior third cervical. This is the right articulation, so in the Blair system this would be listed a PLI. But here's the posterior aspect of the third cervical joint. You can see how far posterior it is of the posterior part of fourth cervical, even though we're not supposed to look at that in Blair. But here, as you move up the articular margin, you can see it ending right here as it notches. And you can see the fourth cervical joints all the way up here. This entire segment is just shifted posterior on fourth cervical. And you can see a similar thing going on here on axis. This joint has also slipped posterior on third cervical. So that's the right side. And we've had this cbct for about a month and a half, and we continue to be pretty excited about it. Here's another posterior misalignment, third on fourth cervical, and you can see again another posterior fourth cervical on fifth cervical. So the fourth cervical is posterior on the left and the right. And by looking at each one of these joints individually, you can see pretty much exactly what's going on in there.